Well, hello everyone and good afternoon. This is Cindy Rogers from the Children's Safety Network at Education Development Center. Welcome to our webinar on reducing the risk to child pedestrians. Before I introduce our two speakers, my colleague Becky Wilmer has a few announcements. Becky?
All right. Thank you, Cindy. So audio is currently being broadcast through your computer speakers, and that means that the quality of the audio depends on the speed of your internet connection. If the audio is choppy, you can either find a more stable internet connection, or you can listen over the phone by dialing 866-835-7973. If you're listening through the phone, please mute your computer speakers to eliminate echo. Phone lines will be muted during the presentation to eliminate background noise. Answers to frequently asked questions are in the webinar instructions pod in the upper left corner, and if you have questions or technical issues, you can type them into the chat box on the left at any time. After the presentation, we will pause for the presenters to answer your questions. We also have a couple of resources available for downloading today above the slide deck. So to download the PDF of the slides, you can click on its name and then select the Download Files button to save the document to your computer. And to view the NHTSA publication, you can click on the title and then click the Browse To button. This webinar will be recorded and the archive will be sent out to all registrants within 2 weeks. All right, back to you, Cindy.
Great. Thank you, Becky. I just want to let everyone know that the Children's Safety Network is supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services under the Child and Adolescent Injury and Violence Prevention Resource Center's Cooperative Agreement. The information or content and conclusions in this webinar are those of the authors and should not be construed as the official position or policy of, nor should any endorsements be inferred by HRSA, HHS, or the U.S. government. We are very pleased to have two speakers today who have extensive community-based, national, and international experience in pedestrian safety. We greatly appreciate our speakers for accepting this challenge of sharing their expertise with us in such a limited time frame. Following both presentations, we will take time for your questions. Our first speaker is Kristin Rosenthal. Ms. Rosenthal is the Program Manager for Road Safety at Safe Kids Worldwide, where she provides oversight to the U.S. and global network on pedestrian, rail, and bike safety programs. Kristin has been at Safe Kids for more than 7 years and in the injury prevention field for nearly 13 years. She is a Master Certified Health Education Specialist and is also a Certified Child Passenger Safety Technician Instructor and has extensive experience in health education and injury prevention. After sustaining serious injuries while being struck by a vehicle as a pedestrian, Kristin is determined to make a difference through education and research on preventing injury. She feels lucky to have the opportunity to work in the field of injury prevention and spend her time working towards something she is so passionate about. Our second speaker is Nancy Pullen-Seufert. Ms. Pullen-Seufert serves as the Director for the National Center for Safe Routes, Associate Director for the Pedestrian and Bicycle Information Center, and Senior Research Associate for the University of North Carolina Highway Safety Research Center, where she has been for 15 years. Her work has focused on pedestrian and bicycle safety and mobility, particularly for children, and she brings a background in public health and injury prevention. Previous to being at the Highway Safety Research Center, Nancy managed an injury prevention program at Mary Bridge Children's Hospital in Washington State. With that, I'll now pass the platform to Kristin, who will start with a poll question for our participants.
Great, thank you so much, Cindy. I just wanted to take a quick poll of everyone who's on the call, the webinar today, and just to describe your involvement and or knowledge of Safe Kids as an organization, either at the national or the local level. If you can just indicate that either you are a Safe Kids Coalition coordinator, if you're a member of your local Safe Kids Coalition, if you're familiar with Safe Kids but you don't currently work with them, or if you're not familiar at all who we are as an organization. It'll just help provide a little background, and when I get into the slides about us, it'll determine how in-depth I get. Okay. Thank you so much. So as Cindy said, I'm going to talk a little bit of background and frame the issue of child pedestrian safety in the United States, and then talk a little bit about what we're doing here at Safe Kids to try and combat the issue. So Safe Kids as an organization, our mission is pretty simple, and it's to keep all kids safe from preventable injuries. And our age frame is 19 and under. So Safe Kids is made up of a global network, and we span across the entire United States as well as 35 plus member countries around the globe. These member countries, they range in their participation with Safe Kids. Some of them are Safe Kids founded organizations, and some are part of larger injury prevention organizations around the world, such as like Asia Injury Prevention, which is in several countries throughout Asia. And then here in the United States, we have a broad network of more than 420 coalitions. The coalitions are all part of a lead agency. I see some of you on the call are a Safe Kids coordinator, so thank you for joining today. And our network is what makes Safe Kids so special and so unique compared to some other organizations out there. You know, I sit here in Washington, D.C. and work, you know, at the national and international level, but we could not do what we do without our boots on the ground, and that's our Safe Kids coalitions and their members who are working every day at the grassroots, you know, level in their community. They know their communities better than anyone else, and so I never want to sit here and tell them what works and what doesn't work. So I try to develop programming and research that can be used in all communities across the United States. So our coalitions are all housed in a lead agency. A lot of them are in children's hospitals. Another big set is public health departments. We have fire departments, police departments, and a few nonprofits out there who all house Safe Kids coalitions. They are employed by the hospital. They're not employed by Safe Kids, but they're all very true to the mission, and there's mission alignment between their organization and Safe Kids on keeping kids safe. So how we work here at Safe Kids is that we are research-based, and we're trying to even grow into that, you know, that spectrum of being very evidence-based programming here. And so we always start with the research. What are the needs are? We, you know, collect observational research, primary research, secondary research. We have grant programs for our coalition, but then we also have a research department here that oversees a lot of that. We want to make sure that what we are producing here at Safe Kids is relevant and up to speed with what is currently going on in the state of injury throughout the United States. And then based on that research, we develop programs here. So we have a broad range of risk areas. Road safety is probably our most well-known. Our child passenger safety program, or Buckle Up, has been around for nearly 25 years. We have a public policy department who's out advocating for local state laws, working with our coalitions to get signatures and letters done, everything in the name of keeping kids safe. And then we have a very robust communications team who work on the awareness when it comes to each of the programs. So they are doing social media, traditional media, writing blogs, anything you can think of that comes with promoting an issue and bringing light to it. So to frame the issue of child pedestrian safety, I know that in the introduction for this webinar, the Governor's Highway Safety Administration work was cited, and that's really looking at all ages, but I think it does give a good picture. But I really wanted to narrow it down and tell you a little bit about what is going on in the world of child pedestrian safety. And the slide that is on the screen currently, this is broken up into two age groups. I know a lot of folks out there, especially at trauma centers or child, you know, hospitals, they really focus on the younger kids. And so I really wanted to kind of show the difference in what works and what doesn't work. And, it's really important to create programs and do research that'll resonate within each of these age groups. So as you can see, that green bar is the 0 to 11-year-olds. And they make up, a pretty big size of that population for 19 and under. And just between 2013 and 2016, we saw a 7% decrease in the rate of child pedestrian deaths in the United States. So what we're doing in regards to keeping little kids safe, it's working. We're teaching them to look left, right, left, to never cross the street without an adult, and those, typical safety pedestrian lessons that you learn as you're growing up. What's interesting about this chart is if you look at the blue line, and this represents those older kids, those 12 to 19-year-olds, and just between the same time frame, 2013 to 2016, there was a 32% increase in deaths for pedestrians. And so we really want to find out what's going on within this age group and why are these older kids so much more at risk than the younger kids, and what can we do as a society and as a community to try and keep these kids safe. So this is also broken down for the ages. As you can see that the majority of kids who are 11 and under are hit in those after-school hours. So most of the time it's dusk, it could be night depending on what time of year and where you are in the country. But when you look at those older kids, most of us probably wouldn't be surprised, but they're out later. They're exploring. They have later curfews. They're not, they have free range to go out and hang out. And so we see a lot of those kids are being hit and killed during the nighttime hours. So some after school, but if you look between 6 and midnight, that's a huge proportion of when all these kids are being struck. Is it issues like visibility, or what do we need to work on with this age group? And this kind of shows it in a different way, but if you look at it, the contrast between the kids 11 and under, 66% are hit during daylight hours, which means they're going to school, they're leaving school. They get home, they're playing in their neighborhoods or playing at the park. But when you look at those older kids, 77% of them are being struck and killed when it's dark out. So how do we bring light to this subject and make sure that they're visible to drivers and paying attention when they're crossing the street? And this is another really important slide to point out, is that we know that at intersections there are slower speeds and drivers are anticipating there'll be pedestrians crossing. So there's a lot of crashes that happen at intersections and pedestrian crashes, but what we don't see are the deaths. Where we see deaths is not at an intersection. So when a kid is crossing mid-block or darts out in between parked cars, when a driver is not expecting a pedestrian, they're going at a higher rate of speed, and their reaction time is going to take longer just by all those other obstacles that are put in place. So it's really important to emphasize to everyone to always cross at a designated crosswalk, intersection, never cross mid-block. Those are where the deaths are happening. So based on all of this that we've learned about the increase and decrease in, the child pedestrian deaths rates over the years, the Walk This Way program, which is Safe Kids Pedestrian Safety Program, which is funded by FedEx, and it has been for now going on nearly 20 years. We operate in the United States. We started in 2000 in 3 cities, and we are now in 225 to 250 communities a year doing pedestrian safety education. We're also lucky enough to be in 9 other countries, which is great because we share methodologies. What we see here in the United States, they see in China, they see in Vietnam. There's cell phones everywhere, there's kids, and what we see in those other countries is that here in the United States, about 20% or less of kids who are killed by motor vehicle are outside the car. But when you flip that internationally, about 80% of the kids that are hit and killed are outside the car instead of inside. And so there's a lot that we can learn from our partners in these other countries. So just a little bit about what we're facing here at Safe Kids and other organizations that work on this issue is that last year, or in 2016, there were 514 child pedestrians killed here in the United States. And on average, 500 children die every day on the world's roads. This is a major public health issue. So we work in 10 countries to create safer, more walkable communities through education, engineering, enforcement, awareness activities, etc. And since the Walk This Way program launched, the U.S. has seen a decrease of 32% overall in child pedestrian fatalities. But as we know, that's starting to creep back up. And then since 2000, the program has reached more than 16 million kids around the world. And these are just some examples of some of the tools that we have available here at Safe Kids. So on the far left, that is some research that we did on how to not get hit by a car. We have an interactive infographic that then depicts that. We developed a Clifford book for those younger kids, and Clifford goes on an adventure with Emily Elizabeth and makes sure that all the kids get to the park safely. And then we have this Take Action Toolkit, which I'll talk a little bit more in depth about at the end of the presentation. Oops, sorry. And then some of our different programs that are under the pedestrian safety or the Walk This Way umbrella. We have America's Favorite Crossing Guard, which is in its second year, and we'll be heading out to Grand Forks, North Dakota next week to crown the next America's Favorite Crossing Guard. We have our Safe School Zone project, in which we partner with Nancy, the next speaker, and her organization on looking at environmental changes in school zones and making those communities safer for kids to walk to school by doing lower cost infrastructure improvements. We have our Take Action Against Distraction contest, which is focused on more of that preteen, teen, about keeping their devices down as they cross the street. Our flagship program is really International Walk to School Day. That's what we started with here. It's a one-day awareness event, but it does, bring light to the issue of pedestrian safety and keeps people motivated year-round to do some more impactful work like the Safe School Zone project in their communities. And then every other year we participate in Global Road Safety Week. It will be in May of next year. The theme has not been announced yet, but we've gotten really lucky in the last few years that one year it was pedestrian safety and another year it was children. So I don't anticipate being as lucky this next time around, but we will be holding events around the globe in coordination with all the other organizations like the WHO and who work in pedestrian safety. So what I'm going to talk to you about today is some of our past research that brings us through today and what we're currently working on here at Safe Kids. So in 2012, we went to work on a 5-year trend report to really just to kind of see what is happening in the last 5 years in pedestrian safety. I'm going to talk about each one of these reports more in depth, so don't worry. In 2013, we released Teens and Distraction, which was an observation study that we did of observing kids crossing the street in school zones on their way to school. In 2014, we released a research report, Teens on the Move, which was a survey done with teens. In 2015 is when we created that interactive infographic on the 7 most common ways that pedestrians are hit. 2016, we did another observational research report, but this time adding in drivers in school zone as well as the child pedestrians. And then last year, we created the Take Action Toolkit, which is an interactive online guide that can help communities navigate and advocate for safer school zones. So when we did this trend report in 2012, before this time, Safe Kids really only focused on 14 and under, and that was because of our children's hospitals who are level 1 trauma centers, and they only go up to 14. And so when we looked at it, we were like, oh, great, gave ourselves a pat on the back, look at the reduction in child fatalities from, being hit by cars over the years. And then we were just kind of sitting around and talking about, a different angle we can take on it because there's nothing new there. We wanted to just dive a little deeper and see what is really going on. And so we're like, let's just take a look at that older age group just to see. The CDC had just released their National Action Plan, and it went up to 19. So we're like, okay, if the CDC is going to go up to 19, let's take a look at what's going on there. And this is what we found is that there was a huge spike in older kids' death rate for pedestrian-related incidents. And so we wanted to find out why. Why is this age group so susceptible? Why are they at this huge risk? And so we developed and implemented a huge observational research study with coalitions throughout the United States. They went out there and they observed kids crossing the street in a school zone on their way to school and after school on several occasions to try and get the most accurate data. And what we found is that 1 in 5 high school students was crossing the street distracted, and 1 in 8 middle school students. And this is being distracted by an electronic device. This isn't reading a book or playing basketball with their friend. This is actually tangible holding an electronic device. And then what we found were the most frequent types of distraction would be talking on the phone was nearly 40%, headphones in nearly 40%, and at this time, texting or actually doing something like typing on their phone was on the lower end, and then a few kids had gaming devices. And so based on this research, we came up with the Moment of Silence program. It's a campaign that brought light to the issue of distracted walking for teens, and it was really in honor of Christina Ward, who was crossing the street on the way to school. It was dusk, she had headphones in, and she was hit and struck and unfortunately killed right here in the DMV area. And so we really wanted to bring light. So we have this video. It's available on our website. I can send the links to our hosts, and they can include them in any communications they send out after. I don't think it'll play very well. But yeah, so we just wanted to bring light to this issue. So then the following year, we wanted to go a little bit more in depth. So we did a survey of 1,000 teens, and we wanted to find out what their attitudes, knowledge, and behaviors are when it comes to being pedestrians. And so one of the main problems we found, surprisingly not, is distraction, and that 50% of the kids said that they crossed the street distracted. No shame in saying that. And this is in 2014, and we know that times have definitely changed, and more kids even have cell phones these days. And so one important message is heads up, phones down. Do not cross the street distracted. Another issue that we found, and this aligns with the research that I showed you earlier, is that walking in the dark is a huge risk factor. Between 7 p.m. and 7 a.m., we saw that 73% of those teen deaths are occurring during that time. And so we want a message to kids to be especially alert when it's dark out and to be visible to drivers. Don't walk around, I'm not a good example, but you can't see me, but all black most of the time. And it's really hard, for at night to be seen, especially walking around here in Washington, D.C. And then the third issue that we found, again, was crossing mid-block, and that teens had been hit or nearly hit more frequently crossing mid-block or running across the street at an undesignated location. And we know a fatality is more likely to occur at that non-intersection location. So we just want, again, to reinforce to cross at a crosswalk, cross at an intersection where drivers are going to anticipate seeing you. And then based on this research, we came up with the Take Action Against Distraction contest. That it was a peer-to-peer education program that we worked in about 60 communities throughout the United States. And we asked teens to create a video or a concept of a video to tell their friends or their peers to put the phone down when they cross the street. The winner came from Baltimore, and it was the same week that all the rioting started. So we were up there filming like Tuesday and Wednesday, and then the rioting broke out at the end of the week. And so these kids were going through a lot at that time, but put so much effort into this video. And again, I'll send the link out, and Cindy can send it after the webinar. But take a look at it. It's really catchy. Just warning you, it will be stuck in your head for days, but a good way. And then in 2015, we developed the interactive infographic, and this was the 7 most common ways that people, mostly children, but really anyone, can be hit by a car. And we set it up that we wanted to state what the problem is, a stat that backed it up, and then a tip. So we wanted to let people know not just that they shouldn't do something, but why they shouldn't do it. And then we have a flat infographic, and it was translated into 6 different languages thanks to our global network of folks. They took it and they're like, this is amazing, and they translated it. And so we have all of those available on our website, or you can contact me as well. And that interactive infographic, we updated it last year, and so it does have updated stats and everything, and it's still live, and you can feel free to use it. It's a great teaching tool to do something a little bit different than just an assembly-style presentation. And then in 2016, we wanted to look back at anything that had changed since our 2013 observational research project. But this time, we really wanted to also look at driver behavior. As you know, a lot of parents don't allow their kids to walk to school, and they don't allow them to walk to school because there's so much traffic. And what I wish parents would realize is that them driving their kids to school is creating that traffic. And so we went out again. We had 25 coalitions across the United States go out and do observations of kids crossing the street in school zones, and then as well as drivers in designated drop-off and pickup locations. As we know, as we've been talking about, that pedestrian death rate for these older kids has been creeping up every year. And so even compared to when we did this study originally, you can see that there's 5 teen pedestrian deaths every week in the United States, and that was a 13% increase at that time. And now we know there's a 32% increase between the last time this data was ran. So it is just continually growing, and it's becoming an epidemic. And so what can we do? So for this project, we came up with some interventions, and we had some stencils that were put down near crosswalks, just as a reminder, heads up, phones down, just simple as that. And then we had the same message on lawn signs that we asked coalitions to put up around the pickup and drop-off zone. And I still get requests to this day for these stencils and for these signs or for the artwork. So if you're interested, I'm happy to share the artwork with you if your community would want to put them up. And so after all this was said and done, we observed nearly 40,000 middle school and high school students and 56,000 drivers in school zones. And what we found probably isn't too surprising. We found there was an increase in distracted walking between 2013 and 2016. So now we're seeing 1 in 4 high school students distracted and 1 in 6 middle school distracted. And we also saw a flip in the mode of distraction. If you remember before, texting was on the lower end, and that's beginning to rise in the increased use of FaceTime and Skype and different mobile apps that you can talk to people. And then headphones was the most risky or the most frequent that we saw. But unnerving, it wasn't just distraction we were looking at. We were looking at all behaviors of kids crossing the street. And 80% of the kids that we observed, so 80% of those nearly 40,000 kids, was doing some type of unsafe behavior while crossing. And that is so scary to me, I don't even know what to say, because that's either they're not looking, they're distracted, they're crossing mid-block, they're getting dropped off, not inside a designated pickup drop-off zone, and cutting through buses and double-parked cars and things of that nature. So it's really scary when you think about 80% of those students were choosing to do an unsafe behavior crossing the street. And then we saw nearly 1 in 3 drivers were doing something unsafe. It could have been going rogue and dropping their kids off across the street because they don't want to wait in the long pickup and drop-off lanes, or they're texting, or they're on the phone, or they have their kids sitting in the front seat so they can hop out quickly and they're already unbuckled when they pull in, and things of that nature. So based on all of these things that we observed, we needed to come up with something that communities can do, a community-focused plan. And so we came up with this call to action so communities can really get involved. And so we want people in schools and students to be able to advocate for things like crosswalks and speed limits, lower speed limits, signage and traffic lights, crosswalks. You know, it's so crazy to think there's so many schools out there that don't even have a designated crosswalk. So at 3 out of the 10 schools, 3 out of 10 observed crossings, there were no crosswalks that were painted for those children to use. We know, as Nancy's going to talk about, you know, Vision Zero and reducing speeds and keeping kids safe. You know, if a car is going 20 miles an hour, there's only a 5 to 10% likelihood that they're going to be killed or severely injured. But when that car is going 40 miles an hour, we know that children have an 85% chance of being killed or severely injured. So lowering those speeds is really important. And then coming up with school drop-off and pickup zones, and not just having the plan, but enforcing the plan. So this is where the Take Action Toolkit came from. And it is 6 different scenarios in a school zone that ranges from pedestrian safety to bike lanes, for illegal passing of school buses, which if you've ever seen any of those videos, they can be some of the scariest things in the world when you see a tractor trailer passing a school bus on the right-hand side when kids are trying to board. I'm not lying, I've seen it, it's frightening. And so you can go through, this is interactive, and within this toolkit, there's everything you would need to go to your local policymakers or your school, the PTA, the principal, the superintendent, and say, hey, here is the evidence for the effectiveness of a designated drop-off and pickup zone. And it's not just having it in place, it's the enforcement of it. So all of these tools are there. The letters to Congress, letters to mayors, anything you would need lives in this infographic. And so how can you get involved? So how can you try to make change in your community when it comes to keeping kids safe? And so here's some ways. You could find your local Safe Kids coalitions. And for those Safe Kids coalitions who are on the call or on the webinar today, I'm going to put it out to you to contact those local stakeholders in your community and partner with them, work with them. You know, we all have the same mission. There's no reason for us to be working in silos or independently of each other. Put our forces together and we can do much bigger things. Share our resources. All of this lives on safekids.org. And so you can utilize any of this information to get it into your communities. Partner with us. Find your local Safe Kids Coalition. Become a member. Find out when their meetings are and how you can get involved. Or then take action and use that toolkit to advocate for safer laws in your community when it comes to keeping kids safe on their way to school. That's everything I have. So I want to thank you for your time, and I'm going to turn it over to Nancy at this point. Thank you.
Good afternoon, everyone, and thank you, Kristin. Tough act to follow. I really appreciate, in true Safe Kids style, Kristin just really framed what the issues are for us when it comes to children and youth and walking. And then, of course, talking about all of the different resources that are available. So, you know, as much as I followed Safe Kids work, I certainly learned about some new things that had me writing things down while you were presenting, Kristin. So a little bit more about me and what I'm going to talk about. Again, Nancy Pullen-Seufert, National Center for Safe Routes to School, and just really pleased to be talking to you today about our Vision Zero for Youth initiative. But before I jump into that, I want to tell you a little bit more about the broader place that the National Center for Safe Routes to School is located in, which is the Highway Safety Research Center, which is also where the Pedestrian and Bicycle Information Center is located. And the Pedestrian and Bicycle Information Center serves as the U.S. Department of Transportation's clearinghouse for pedestrian and bicycle research and information. So we really work across the spectrum in protecting pedestrians and bicyclists from changes to roadway design and operations, to enforcement, to education of drivers and all road users, to promote and support walking and biking and transit use. The Highway Safety Research Center also has the Collaborative Sciences Center for Road Safety within it. And there we are really looking more broadly at the systems and practices across our society that influence safety on the road, ranging from opiate addiction and how ideas spread from city to city to help support better safety for really all of our road users. But my focus today is really going to be on the National Center for Safe Routes to Schools Vision Zero for Youth work, which grew out of our past role as the Department of Transportation's clearinghouse for the federal Safe Routes to School program for more than 11 years. We saw progress that was made by states in improving safety and encouraging walking and biking, and we didn't want communities to lose sight of the continued and very real need to protect children and youth, and also, of course, gave us an opportunity to talk and think about beyond just the trip to school, but really all the places that children and youth need and want to go on foot and by bicycle as well. So we're also starting to really see that starting with children can serve as a catalyst for building buy-in for Vision Zero, or just proposing new infrastructure improvements and getting them on the ground and getting that support from elected officials and community members that's needed. This is the kind of buy-in that we need in order to make big changes in how our roadways are built and who has space on those roadways, not just automobiles and trucks, but really thinking about pedestrians and bicyclists and transit users and a shared responsibility for safety. And when I talk about shared responsibility, you know, we're thinking much more broadly now, not just sharing responsibility among roadway users, but extending that to roadway designers as well. So before I jump into things further, I do also, just like Kristin, have a poll for you, and it is related to Vision Zero, mostly because I want to get a better understanding about sort of your involvement or awareness of Vision Zero. So the options here as you see them, I'm familiar with Vision Zero, but there really doesn't seem to be a lot of talk about it in my community versus familiar with it personally, and there is discussion and talk within the communities where I work, or, hey, I am not familiar with Vision Zero, but I kind of feel like others are working on it, or I'm not familiar with Vision Zero, and I don't know if other people are working on it in my community. So it looks like, as we're looking at things coming in, we have nearly half saying, hey, I really don't know what's happening around Vision Zero, and I'm not particularly familiar with it myself. And then folks who say, yeah, I'm familiar with it, and there are people talking about it. So very interesting, gang. Y'all represent kind of like the two different ends of the spectrum. Either you are involved in it because it's happening, or you're not hearing so much conversation about it. And really, I want to reassure you that for those of you who are less familiar with Vision Zero, the concepts and the ideas that I'm talking about today really have takeaways for you as you're thinking about addressing pedestrian safety for children within your communities, and sort of what the opportunity points are for that, as well as, of course, for those places that either are starting to talk about Vision Zero or are implementing Vision Zero very actively. And then, of course, very quickly, I want to define, for those of you who said, hey, I am not familiar with Vision Zero, Nancy, kind of what that is. And very broadly, cities around the United States and really around the world are committing to a specific date when they will reach zero traffic deaths on their roads. The concept began in Sweden, and with it now spreading across the U.S., we're really getting a chance to see what it can look like here. And really the bigger story here is that the conversation now is really much more about how we build our roads and making space for all road users, and the important role of design in all of that, and thinking about those people who design our roadways and what responsibility they should be taking on as well. So on that, let me tell you a little bit more specifically about what we have been working on over the last couple of years, our Vision Zero for Youth initiative, which very much focuses and builds off of Safe Routes to School, focuses on encouraging cities to commit to prioritizing safety in places where children and youth walk and bike. And it really is as simple as that, and really our opportunity to be sure that we're continuing to push for attention to that, even as we've seen, sort of changes in commitment levels with Safe Routes to School. So why do we care about this stuff? I like to talk about this just to remind all of us about who our stakeholders are and why they might be interested. And, there are benefits to physical activity for people of all ages. There's a lot of good evidence now about the value of physical activity for children in terms of their academic success. And so if we're able to create spaces where children and youth can get to school on foot or by bike, that gives them some of that physical activity that can help really kick off their learning throughout the day. And of course, the broader context of this that Kristin already spoke about is really the increase in pedestrian deaths that we're seeing, even while in the U.S. overall traffic deaths are going down. So our model, our premise is very simple. We're seeing growing interest, but really know that in order for cities to get on board and commit to zero traffic deaths, there has to be political will and city staff buy-in to do that, as well as having that public backing. Elected officials aren't going to take action if they don't think that their constituency is going to back them up on that, and that children and youth are the perfect place and a really important part to start in order to improve safety for all road users, with a particular emphasis on kids. So one of the things we did as we were developing and sort of testing out our ideas around Vision Zero for Youth is we did a very small study of 6 cities, and we asked at least 3 key informants with each city to tell us a little bit more about Vision Zero and what was happening in their cities. So these were 6 cities that all were early adopters, at least considering doing Vision Zero. And I really wanted to include this one quote because I think it captures really well how some cities are quite dialed into this idea of the value and the importance of prioritizing children, both for their own safety as well as the opportunity to impact all road users. So why do we think this holds promise, and really an opportunity to hook into kind of bigger priorities around road safety? And the first is around what the diffusion of innovations theory tells us, which I'm not going to get into in great detail, but I do want to tell you that we have gotten into it in great detail. It's been fascinating for me to learn from some of my colleagues about this, but really testing out this idea of when we look at how innovative ideas spread and which ones spread, the ones that tend to spread have some common characteristics to them. And one of the things that we see is that they have strong opinion leaders, and that those who tend to be in our initial, group of adopters really are ones that have some readiness already, of course, and really see how it helps kind of meet a broader value or a broader goal that they have. And starting in school zones really is kind of that readiness, that opportunity point. Also, one of the wonderful things about our world, I think, is that there really is a shared community value for children's safety. And I just heard a lecture by someone who helped write the CDC's framing guide that came out a few years ago for injury prevention professionals. And she was telling us about the focus groups that they did when they were forming the messaging, and that one of the messages that really resonated was around helping people live their life to their fullest potential. And I really think that is even more so with children. And when there are so many things that communities can be quite divisive about, when we find that common ground, it truly is an opportunity for us to use that as a toehold. And one of the contentious issues when we think about road safety is really around tackling speed, and starting in school zones is a way that we can start talking about that more and giving people an opportunity to be exposed to what some strategies around that might be. I'm going to talk about that more in just a minute. And really just, by way of background for you, speed management is such a critical piece of safety. According to a very recent National Transportation Safety Board report on speeding, 1/3 of traffic deaths are attributable to speed. And in school zones, we have a variety of ways that traffic can be calmed. And if we can really have some good examples for what this looks like in school zones, and communities are open to adopting them, that gives us an opportunity for them to then be open to using some of those things in other places. So one example I just want to share is from New York City DOT, which does lots of amazing work and also has the opportunity to really evaluate their work. And they had an area, Caton Avenue, they were going to be building a new middle school off of it, and at the same time they had a student killed in a hit-and-run crash. And they decided to really make a lot of aggressive changes to the intersection and saw an impressive reduction in pedestrian injuries of all ages, down by 40%. And it's that kind of really promising news where we know what can work to improve pedestrian safety. And really, our challenge is how do we get this spread to more places. Kristin told you a little bit about Safe Kids Walk This Way and International Walk to School Day, which is something that we are quite involved in as well. We serve as the national coordinators for Walk to School Day and Bike to School Day in the U.S. The Walk to School Day began at the Highway Safety Research Center in 1997, so more than 20 years ago. And communities really have taken hold of using it to help promote walking and to bring attention to different safety needs that might be present in their community. So we wanted to use the 20th celebration of Walk to School Day to launch our Vision Zero for Youth initiative, which we did, and we held our national event in Washington, D.C. Mayor Bowser came. She was amazing and is equally compelling for children to listen to as well as adults. And we asked her to sign a mayor's statement that we wrote, and she agreed to do that. I wanted to show you what the mayor's statement says because we have this available on our website, and I really encourage you to use it or modify it. And really what we wanted to do was to give elected officials some language to talk about their commitment to safety and how that ties together with their vision of their community. And really, we carefully crafted this language based on interviews that we conducted with mayors around the U.S. and asking them about what they cared about and trying to link that back to safety and a priority for children. So a little bit more about our 2016 launch. Local event organizers, we encouraged those who were planning walk-to-school events to invite their mayor, and more than 1,500 mayors were invited. A quarter of all events included a mayor or other elected official. That was reported to us after events happened by walk-to-school organizers. And of course, as we think about that in a more like broader, bigger picture, right, because what we care about is really so much more than the event, but it's about what that event can lead to. And the majority of events do lead to, according to event organizers, these longer-term changes around policy or changes to the roadway or signage, things that help improve safety every day. So then in 2017, we saw some really amazing, impressive increases in Bike to School Day participation and Walk to School Day participation. And again, this is very much community-driven. And we also decided to establish a Vision Zero for Youth Leadership Award. We gave it to the Mayor Garcetti at the City of Los Angeles in partnership with the Los Angeles School District. Why did we pick them? Two reasons. Number one, they were one of two cities who were the first to celebrate Walk to School Day back in 1997. And now they are demonstrating a strong commitment to child pedestrians really by making safe routes to school be one of the core strategies of Vision Zero. And we really think that this kind of exemplifies what Vision Zero for Youth can do and look like for cities. They use a data-driven approach to prioritize different schools for safety improvements. They have a strong partnership with their school district. The school district developed a resolution in support of Vision Zero, in fact, and they also have made efforts to slow down traffic around schools. We have a case study about Los Angeles and what they've done that is available on our website as well, which I'm going to share with you at the end of my presentation. So what are we doing now? Oh my goodness. Well, one thing that's been very interesting to us is sort of a growing interest internationally in Vision Zero for Youth. Of course, we have a strong commitment to wanting to understand what the possibilities are in the U.S. As part of that, and really growing what we were able to offer and share about Vision Zero for Youth in terms of what it can look like for cities and what the opportunities are. And of course, engagement with elected officials and really seeing the power of Walk to School Day and Bike to School Day as being opportunities to do that. So of course, I have to put in a plug for Bike to School Day, which is, believe it or not, right around the corner next week, May 9th. If you are interested in learning more, I encourage you to go to our website, walkbiketoschool.org. You might be thinking, well, it's next week, so maybe next year, Nancy, and I want to give you a plug. One of our most popular resources on our website is how to plan an event in 7 days, gang. It's not too late. And really, I want you to take a look at the mayor's statement. Interested to see if you think that that is something that might be helpful to you. Interested to hear more about your specific experiences with prioritizing children's safety and how do we make that really compelling and moving communities towards action for that. The website I was referencing a minute ago with the case studies on it is our visionzeroforyouth.org website. I encourage you to look at that. That's also where we have the mayor's statement if you would like to see it. And then here's a list of all of our websites that have resources on it. Walkbiketoschool.org is where Bike to School Day registration happens. And of course, want to strongly encourage you to find out what's happening in the communities you work with and opportunities to celebrate Bike to School Day, which really can be throughout the month of May. The entire month is Bike Month, and communities do celebrate Bike to School Day on all different days on that month. And on that note, I'm going to turn it back to you, Cindy, and also thank you to each of you for being on the phone today.
Well, thank you, and what great timing for Walk and Bike to School Day. So I hope many of you will check that out and use your time to get things organized in your community. So great presentations. I want to thank both of you for the information, for the incredible resources that you shared. I invite our participants to type your questions into the chat Q&A box to the left of the screen, and I will read the questions. We do have a few minutes before we need to adjourn. So one of the questions is, and this is for either or both of you, how do we change the focus of engineering standards or guidelines to be more focused on pedestrian safety, especially for the child traveler, as opposed to optimizing traffic movement? Or is there a conflict there, or are they the same?
Kristin, do you want me to go first?
Go ahead.
Okay. You know what? I think this is an issue whose time has really come. There are a lot of communities that are grappling with this very thing, and I really think that's one of our opportunity points is by talking about our value for children's safety. That changes the tone of the conversation, particularly when we have an engineering community that went to school to learn how to prioritize efficiency for cars. That's what they were trained to do. And so right now, there is this sort of paradigm shift that's happening when we think about, okay, how do we make space for all road users? And so I think we're at a good point for doing that. I lost the second half of what I was going to say. So, Kristin, I'm going to turf it to you for a second.
I was just going to chime in and say there are some organizations who are working on this. Complete Streets is doing a great job, and they actually just launched the Complete Streets for Kids campaign that they're going to be doing and doing some of those engineering recommendations. So many people now live in the suburbs, and when suburbs were built, they were designed for the driver and not for the pedestrian. And organizations, like what Save Kids is doing and what Nancy is doing and Complete Streets, it's taking another look at that and seeing how can we improve the infrastructure that's already there most effectively to make it safer for not just children, but if we make it safer for those most vulnerable populations, you'll make it safer for everyone. So it's kind of looking at those engineering countermeasures that have been proven and tested. And some of them you can do pretty cheap. It doesn't have to take New York City capital budget to do. And so it's just kind of taking a look at the options that are out there.
Great. Thank you both.
Could I add on to that? There's one other resource that is underway right now. For those of you who are familiar with NACTO, the National Association of City Transportation Officials, they have some different design guides that they have developed, and including like a global design guide, and they are now creating an addendum to that, a supplement to it that really is focused on child pedestrians and making our streets more child-friendly.
Great. Thank you both. Excellent. So what about child pedestrian safety in rural areas, and is there a Vision Zero policy for suburban communities? So it seems like a number of the campaigns may be more geared for larger communities, larger cities. Are there some differences with rural and suburban communities?
For sure, and I'm really glad this has been mentioned because this is part of the struggle, right? Like we have these very large urban areas that have kind of, taken up the challenge of Vision Zero, and what of that translates for smaller communities. So you'll see that one of the case studies on our Vision Zero for Youth website is about communities of 15,000 and less. They were some of our earliest adopters of Vision Zero for Youth, and really those elected officials, those mayors were some of the ones who spoke, I think, most compellingly about the visions that they had for their community and sort of how that fits with walking and creating places for people of all ages to be. So I guess I would encourage you to look at that as a starting point. Kristin, did you want to add anything to it?
I think if our Take Action Toolkit, you can take a look at that. There are some aspects that are designed for a more rural community, but we're happy to work with you or talk with you or kind of steer you in the right direction of your local Safe Kids in your community who can help on some of those more rural aspects. We're starting to build our programming around rural communities, so we're happy to hear any feedback you might have.
Great. Thank you. Before we close, because it's already almost the top of the hour, I want to make sure everybody is aware of our next webinar, which is actually happening this Thursday. And in this webinar, we'll hear about resources and strategies from the Child Safety COIN, or the Collaborative Innovation and Improvement Network. You can click on this link here to register for that webinar. And in closing, I want to thank our presenters, Kristin Rosenthal and Nancy Pullen-Seufert, for their fabulous presentations, all of the resources and tools that you've presented. And thank you, our audience, for your time today. And finally, we do have a quick evaluation of today's session, and I hope you'll take a moment to complete this. It is 4 o'clock, and we'll adjourn the webinar, but thanks, everybody, for joining us.